Top warning signs your liver is dying. The liver is one of the most important organs in the body, responsible for a wide range of vital functions. It helps detoxify harmful substances, produce bile for digestion, store vitamins and minerals, regulate blood clotting, and metabolize fats, proteins, and carbohydrates. When the liver becomes damaged, whether due to disease, lifestyle factors, or other conditions, it can lead to liver failure. Liver disease and liver cancer are serious health conditions that can progress silently, often showing few symptoms until the damage is severe. However, by recognizing the early signs, it is possible to catch liver issues before they escalate. In this video, we will explore the various signs and symptoms that may indicate liver failure, liver disease, or liver cancer. These signs or symptoms can range from subtle changes to more pronounced signs, so it's important to pay attention to your body and seek medical advice if you suspect a liver issue. 1. Jaundice, yellowing of the skin and eyes. Jaundice is one of the most recognizable signs of liver problems. It occurs when the liver is unable to process bilirubin, a yellow substance that is a byproduct of the breakdown of red blood cells. When bilirubin builds up in the blood, it causes a yellowing of the skin and the whites of the eyes. Jaundice can be a sign of several liver conditions, including hepatitis, which is the inflammation of the liver, often caused by viral infections such as hepatitis B or C, alcohol use, or autoimmune diseases; cirrhosis, scarring of the liver tissue, which impairs its ability to function, and liver cancer. Other symptoms may accompany jaundice, such as dark urine and pale stools. These occur because the liver is not processing bile properly, leading to changes in waste elimination. 2. Fatigue and weakness. Fatigue is a common symptom of liver disease and liver failure. When the liver is damaged, it struggles to perform its normal functions, including detoxifying the blood and regulating energy levels. As a result, the body may experience extreme tiredness and weakness. This fatigue can be overwhelming and may not improve with rest. It is often one of the first signs that something is wrong with the liver, and it can be a key indicator of chronic liver conditions such as cirrhosis, hepatitis, or liver cancer. Fatigue and liver disease can also be linked to anemia, a condition where the body does not have enough red blood cells to carry oxygen to tissues. The liver plays a role in the production of certain proteins that aid in red blood cell formation, and when it fails, this process can be disrupted. 3. Loss of appetite and weight loss. A sudden loss of appetite or unintentional weight loss can be a warning sign of liver disease or liver cancer. When the liver is not functioning properly, it can cause metabolic imbalances that affect hunger and digestion. This lack of appetite is often accompanied by feelings of nausea or a general disinterest in food. Liver cancer, in particular, is associated with unexplained weight loss, as the cancerous cells use up more of the body's energy, leading to muscle wasting and fat loss. In advanced stages of liver disease, a person may also experience cachexia, a condition characterized by extreme muscle loss and weakness. If you notice a persistent lack of appetite or unexplained weight loss, it's important to consult a healthcare provider, especially if you have other risk factors for liver disease. 4. Nausea and vomiting. Nausea and vomiting are common symptoms of liver disease and liver failure. When the liver is unable to filter toxins from the blood, these toxins can build up and affect the digestive system. This can lead to frequent episodes of nausea, especially after eating, as the liver struggles to process the nutrients and fats from food. Nausea may be accompanied by vomiting, which can further contribute to weight loss and dehydration. If nausea and vomiting persist without any clear cause, it could be a sign of liver dysfunction and should be evaluated by a doctor. In some cases, nausea and vomiting may also be related to liver cancer, especially if the tumor is affecting nearby organs or tissues. 5. Dark urine and pale stools. Changes in the color of urine and stools can indicate liver problems. Dark urine is often caused by an excess buildup of bilirubin in the blood, which is a sign that the liver is not processing bile properly. Urine may appear dark yellow, orange, or brown in color. Pale or clay-colored stools occur when the liver is not producing enough bile, or when bile flow is blocked. This can happen in conditions like hepatitis, cirrhosis, or bile duct obstruction, all of which affect the liver's ability to process and eliminate waste. If you notice persistent changes in the color of your urine or stools, it's important to seek medical attention, as these are often signs of liver dysfunction. 6. Bruising and bleeding easily. The liver is responsible for producing proteins that help the blood clot. When the liver is damaged, its ability to produce these clotting factors is impaired, leading to a higher risk of bruising and bleeding. People with liver disease may notice that they bruise more easily than usual, even with minor injuries. They may also experience nosebleeds, bleeding gums, or prolonged bleeding from cuts or other injuries. In more advanced cases of liver failure, internal bleeding may occur, particularly in the digestive tract, leading to vomiting blood or blood in the stool. This tendency to bruise or bleed easily is often a sign of liver cirrhosis or advanced liver disease, as the liver's ability to maintain proper clotting is severely compromised. 7. Swelling in the legs and ankles, or edema. Swelling in the legs, ankles, or feet is a common symptom of liver disease, particularly in cases of cirrhosis or liver failure. This swelling, known as edema, occurs when the liver is unable to produce enough albumin, a protein that helps regulate fluid balance in the body. When albumin levels drop, fluid leaks out of the blood vessels and into the surrounding tissues, causing swelling. Edema may also be a result of increased pressure in the blood vessels due to liver scarring or cirrhosis, which can lead to fluid retention in the lower extremities. In addition to edema, people with liver disease may also develop ascites, fluid buildup in the abdomen, which can cause discomfort and breathing difficulties. 8. Mental confusion and cognitive issues, or hepatic encephalopathy. Liver failure and advanced liver disease can lead to a condition known as hepatic encephalopathy, in which toxins that are normally filtered by the liver build up in the bloodstream and affect brain function. This can cause a range of cognitive and neurological symptoms, including confusion, memory problems, difficulty concentrating, personality changes, mood swings, slurred speech, tremors. Hepatic encephalopathy can range from mild cognitive impairment to severe mental confusion or coma in advanced cases. It is often triggered by high levels of ammonia and other toxins in the blood, which the liver is no longer able to process effectively. This condition is most commonly seen in people with severe cirrhosis or end-stage liver disease and requires immediate medical attention. 9. Spider angiomas, or spider-like blood vessels on the skin. Spider angiomas are small, spider-like clusters of blood vessels that appear close to the surface of the skin. They are typically red in color and have a central body with radiating lines resembling a spider's web. Spider angiomas are commonly found on the face, neck, chest, and arms. These visible blood vessels are often a sign of liver disease, particularly cirrhosis, as they result from hormonal imbalances and the liver's inability to metabolize estrogen properly. High estrogen levels can cause the blood vessels to dilate, leading to the formation of spider angiomas. While spider angiomas can occur in healthy individuals, especially pregnant women, a large number of them can indicate liver dysfunction. 10. Itchy skin, pruritus. Itchy skin, or pruritus, is a common symptom of liver disease. It occurs when bile salts build up in the bloodstream due to impaired liver function or blocked bile ducts. This accumulation of bile salts can cause intense itching, often without a visible rash. The itching is typically worse at night and may affect the hands, feet, or entire body. Scratching the skin can lead to lesions or infections, which can further complicate liver issues. Pruritus is often associated with conditions like cholestasis, or impaired bile flow, primary biliary cholangitis, an autoimmune disease that affects the bile ducts, and liver cirrhosis. 11. Enlarged breasts in men, or gynecomastia. Gynecomastia is the enlargement of breast tissue in men and can be a sign of liver disease. This condition occurs when the liver is unable to properly metabolize hormones, leading to an imbalance of estrogen and testosterone. The increase in estrogen levels causes breast tissue to grow, resulting in enlarged or tender breasts in men. Gynecomastia is commonly associated with cirrhosis, particularly in cases where the liver has been damaged by alcohol abuse. It may also occur in people with other forms of chronic liver disease or liver failure. Your liver plays a vital role in your health, and it's essential to catch these warning signs early. If you're experiencing any of these symptoms, please don't ignore them. Consult your doctor and get a proper diagnosis. Early intervention could make all the difference. Thank you for watching. Remember to like, share, and subscribe to Vitality Unplugged for more health tips and important information to help you live your best life.